Welcome to UPLEVEL, Real Health, Real Talk with Dr. Jenna Blasi. I'm Dr. Jenna. I spent years crafting ways to help women thrive, and I want to help you do the same. On this podcast, we dive deep into health at every level, focusing on the mind, the body, and the spirit. This is where real conversations meet transformational wellness. We'll be talking about all the things that truly matter, from nutrition and fitness to lifestyle, mindset, and personal development. Plus, the real deal on managing stress and navigating menopause. So if you're ready to elevate your health journey with authentic, transformative insights, you're in the right place. Let's get started. Hello, and welcome back to UPLEVEL. I'm Dr. Jenna, and today we're going to talk about hair loss, which is a sensitive topic, but it's one that comes up a lot. We have a lot of patients that ask me about this. So I want to discuss the causes of hair loss, how to identify it, and what you can do about it. If you have ever stood in the mirror or stood in the shower, seen clumps of hair, stood in the mirror and seen more of your scalp showing, this can be really heartbreaking. And so this is for you. I want to talk about what's going on and why, just the advice of just take some biotin is not enough and probably not serving you. So let's go briefly through the hair growth cycle. Hair grows through phases of growth. So there's the anagen cycle, and this is the active growth phase where the follicle is producing new hair. And then there's the transition phase, which is the catagen, it's brief, but it's that transitional stage where the follicle begins to shrink. And then there's the shedding or telogen phase where hair is no longer growing and it's preparing to shed. Disruptions to this cycle from stress, from trauma, nutritional depletion, they can push more hairs into the shedding phase. And this is called telogen effluvium, and it often shows up about 3 months after a major stressor. We've heard of this a lot for people after COVID, for example. It also occurs after crash dieting or extreme diets, surgery, emotional upheaval. It is common, it is reversible, but it's incredibly distressing if you don't know what's happening. So while telogen effluvium is one of the most common forms of hair loss in women, there are others. There's androgenic alopecia, which is that female pattern hair loss that looks like male pattern balding, so to speak. So it's often linked to hormonal imbalance, can also be linked with increased sensitivity to DHT. And then alopecia areata, which is typically autoimmune in nature and presents in patches of hair loss. I've seen it occur on eyebrows as well. So the first cause, the telogen effluvium, which we talked about, is often triggered by stress, as I said, or illness. And this leads to a diffuse shedding all over the scalp. And this is where you might suddenly find clumps of shedding as you're in the shower or you're brushing your hair. Androgenic alopecia is a gradual thinning, and it's influenced by hormones, and there's some genetic influence as well. And then the alopecia areata, that autoimmune, is patchy hair loss. And I have seen this start to reverse as well. Each type may require a different treatment approach. So it's really essential to understand what is driving your individual hair loss. And I feel like this is true really of everything. We can say, oh, diabetes is caused by XYZ, but everybody's path to any diagnosis and everybody's path to any illness, even though it's the same basic illness or diagnosis, it can be a different path, meaning a different cause, and therefore a different treatment. And so when you can work with someone that really individualizes your care, it's incredibly powerful and leads to better results. As I often say with the things we talk about, hair loss is a symptom. Your body's trying to tell you something. I speak frequently of check engine lights because this is one of my biggest gripes, if you will, with the conventional medical system is we're a crisis care. We call it healthcare, but it's crisis care, and it's really good for crisis, but it's not good for preventing disease, and it's not good for turning around chronic disease conditions, which is what 90% of our country's health issues are. They're chronic conditions that can be turned around with getting to the root cause and lifestyle medicine and treating you as an individual, rather than here's a pill, let's just cover this up. Now, this can happen in natural medicine as well. Let me just give you feverfew for your headache. That's fine. It will help you in the moment, but let's also get to the cause. What is triggering your headaches? Is it food? Is it stress? Is it, et cetera, muscle tension, et cetera? And so check engine light. If you went to your mechanic and all they did was turn it off, which is the equivalent of just taking a pill or just removing an organ, what happens to your car? It's likely to break down, right? Can you imagine? They don't look under the hood. They just turn the check engine light off. And so if you're lucky, the check engine light comes back on, right? When we take pills for things or have surgeries, I'm not saying there's not a time and place for surgeries and pills. Absolutely. But we still want to get to the root cause, because if we're just turning that light off, as the analogy with the car, if you're lucky, the check engine light comes back on. And when it comes back on, it's usually stronger, right? So maybe we give you another medication or we increase the dose of your medication. Now, let's get to the root cause and actually address under the hood what's going on. Our symptoms is our body communicating with us. It's trying to tell us something. And every time we suppress, which is what a lot of the medications do, they just turn the message off, they suppress, it will come out another way. The body's trying to express. So imagine in your relationship, you're constantly suppressing your anger. At some point, you'll probably blow up, and it will be even bigger than if it had been really addressed at a root cause. So let's talk about what some of those drivers are that might be leading to your hair loss. Thyroid. This is a big one, especially if it's an autoimmune thyroiditis. So I've talked in other episodes about thyroid. We're going to want to look at the thyroid and how it's functioning. Number 2, declining estrogen or progesterone. So as women go through menopause, they often start losing hair. Also, androgen excess and DHT sensitivity. So excess testosterone, or DHT, which is dihydrotestosterone, is a potent androgen, or quote unquote male sex hormone, that comes from testosterone. And so DHT will bind to the receptors in the hair follicles, causing them to shrink and shorten the hair growth cycle, leading to hair thinning and eventual hair loss, known as male pattern baldness. So looking at the hormones and what's going on with your hormones and how you can support that picture. And we've talked about that in other episodes. Number 3, stress and cortisol dysregulation. This can trigger telogen effluvium, these stressful events and not managing our stress. Stress can also trigger what I'm going to say is another cause, is nutrient deficiencies. So looking at your B12, your vitamin D, your ferritin, ideally you want your ferritin above 70. But even with nutritional deficiencies, I still want to look at why. Why does someone have a nutritional deficiency? Like if it's B12, could be because you're vegetarian or vegan, because we do want to make sure we're getting enough B12. But maybe it's intestinal hyperpermeability, or quote unquote leaky gut, where you're not absorbing your nutrients. Or maybe you don't have a healthy diet and you're just not getting the nutrients. Or maybe you're super stressed and you're using up extra nutrients that your body needs. So I still look at nutrient deficiencies as a potential symptom. Could be a cause, but also it could be a symptom that we want to look at. Well, why do you have those deficiencies? Number 5, and these are not necessarily in order, but a little bit, because these are common ones. Blood sugar dysregulation and insulin resistance can lead to some of these hair loss, hair thinning. And then number 6, gut health and inflammation, which I tied into nutrient deficiencies. I would also tie that into stress, because stress disrupts our gut. So these can impact absorption, as I mentioned just a few moments ago, as well as your immune system and your immune signaling. So what can you do about this? First, I mentioned earlier, this is a delicate topic. I encourage you to set realistic expectations in the healing process. Most treatments aim for about 50% reduction in shedding. It's not a full reversal overnight. However, if I ask a patient, what kind of reduction in symptoms, what kind of reduction in shedding, what kind of resolution are you hoping for, they're typically going to say 90% or more. So there's a gap between what's maybe realistic and what most treatments are actually shown to do and what most treatments are aiming for. Now, you know I'm big on mindset, and the mind is incredibly powerful. So this is, I think, one of the harder things in my practice. And I tell this to people is, I want you to think big. I want you to dream big. I want you to envision in this case, your head full of a big, thick head of hair, while also having patience, being realistic. I don't want to give anybody false hope because that sets us up for disappointment. But I also never want to underestimate our body's ability to heal and our mind's ability to contribute to that, right? We've talked about placebo and nocebo. So for me, there's a balance with this. So I would still encourage, expect, maybe, no, not expect, that's not the word I want to use. Have a realistic aim for, say, a 50% reduction while doing visualization of better results, doing visualization of your hair growing back, your stress being managed, full head of hair, reversal of symptoms, etc. And remember, we get what we expect. That's why I changed my verbiage there. There was years ago, I was working with a woman who had lost a significant portion of her hair. And it's very traumatic. We don't feel safe or good in our bodies often when we don't have our hair. This is a very hard thing for everybody. I think particularly for women, because we have, examples of bald men who are still considered sexy and attractive. We don't have examples of women with thinning hair or balding or patches missing. It's like, oh, look at that. She's amazing. And so we still promote in our society thick, long hair for women typically. And so I had a patient years ago struggling with this. And if you've listened to my mindset podcasts and talks, I talk about acceptance being a big key, because acceptance, I want to be clear, doesn't mean you stop trying for something better. It means you accept what is, and for me, that means you release tension around it. Like if we're trying to conceive and we're not conceiving, when we bring in some acceptance, that doesn't mean we stop trying. That doesn't mean we stop doing everything possible to bring that baby into the world, but it means we release the tension, because that's actually where the healing happens. And that's when we can bring to us what we're looking for. And we've heard these stories of women, for example, trying to conceive, or people trying to conceive, and then they decide, okay, let's just adopt or forget it. And then they get pregnant. So she had bought a wig, and I had tried to encourage her to like, hey, why don't you try rocking the wig? Like really own it. You got this great wig, like bring your sass in and really aim to like feel good in it and rock this wig. And I came off, it seems, as insensitive. And that was not my intent at all. My intent was not, we're going to give up on this. My intent was not, you should just accept this and like lie down and suck it up. But I think that's how she interpreted it. And so I want to be clear in this. This is a hard situation. All of the things that we deal with, for the most part, they feel hard. When we bring in acceptance, when we bring in gratefulness for what is, it shifts our whole mood. It shifts our whole attitude. And then we can try and keep working towards a solution. That's my intent with saying incorporate the mindset into this. It doesn't mean lay down and stop trying. It doesn't mean stop picturing yourself with a beautiful head of hair that you want. But it means let's set ourselves up for success while embracing the journey, really. When I was trying to get pregnant with my daughter, and I had 3 miscarriages, the first one was very, very physically hard on my body because I was 11 weeks pregnant. And so I was like basically like in labor all night, miscarrying. And I still like believed that it was possible to bring another baby into the world. And I was doing my affirmations every day. I'm so happy and grateful now that I have, a healthy baby. And I was also working with, hey, please guide me, Spirit, to let this go and accept what's going on here if this isn't going to happen. So I fully believed and expected it still was, but I was detaching from that outcome, which allowed opportunities to come my way and me to open up to what was happening. I'm not sure if that makes sense, but we'll get deeper into some of these topics and hopefully it will start to make sense. And a friend of mine, her daughter was diagnosed with leukemia when she was 13, and she had, long, thick, lovely, I don't like to put judgments on things, but, lovely hair. She was only 13. And she cut it before she lost it. She said, look, this is going to happen with the treatments that I'm having, and I want to be able to donate this to somebody in need, and I'm just going to own what's going on with my hair at this moment. That doesn't mean later she didn't get her hair back. But let's talk about what you can actually do. Caffeine shampoo is a simple addition that may help stimulate hair growth. There are topical treatments like Rogaine, which are commonly prescribed. There are also oral medications. And in some cases, these drugs might feel indicated, like finasteride. Finasteride is a DHT blocker. Saw palmetto is an herb that can also block the effects of DHT. And so both of these have been used to combat hair loss. Durasteride is similar, blocks DHT. Let me say about saw palmetto, it's less potent than the medications. The herb is less potent than the medications. And the research is not robust on saw palmetto, but there is some promising research on its effects on hair growth and hair loss, and just overall effects on hair. And I have seen patients feel that they get good results with saw palmetto, especially if their DHT is high and it actually helps them manage it. And others feel they need something more potent to block the DHT, depending, again, individual approach, depending on what's going on and what the reasons are and what the full hormone picture looks like. Saw palmetto is certainly it's a quote unquote gentler option that you could try, because a lot of the people listening to my podcast they gravitate more towards the herbs than the medications. But if DHT is part of the problem, that's the dihydrotestosterone, then using something to block it would be an effective treatment. And we need more research on saw palmetto. So hopefully the research will get more robust as we go. And then lifestyle changes. I think I say this in every episode, addressing those underlying stressors, addressing those underlying nutritional deficiencies or gut inflammation. These things will help. And when we're talking stressors, especially for telogen effluvium, and then adequate protein. This probably also comes up in most of my podcasts, and a ferritin above 70. Ferritin is one of those above 100. We're probably looking at an inflammatory response, so it's not super indicative. But when people, especially women, drop below 50 or below 50 to 70, so like 70 is kind of that nice ideal place, they don't feel as well. They're more tired, and hair loss can show up more frequently. And then there's advanced treatments like options like acupuncture or PRP, which is platelet-rich plasma, or laser therapy. These are being explored as well. And so if that calls to you, you might want to explore that. So let me close with saying it's important to consult with a healthcare professional to determine the cause of your hair loss, as I said earlier, and the most appropriate treatment plan for you. So the right guide, the right mentor, the right practitioner can help you understand your options, set realistic expectations. I don't like the word realistic. I really don't. And so that's that balance that I want you to go back and listen to if it didn't quite sink in. Realistic means let's understand what the research shows, but then still dream big and visualize big, but maybe have patience in the journey. That it's not going to be 90%, for example, overnight, and work on that acceptance and that gratitude through the process. But it's really most important that you monitor your progress over time and that you work with someone who understands the whole picture, who will help you monitor progress over time. Because let's face it, hair loss is not just cosmetic. As I said, it affects how you see yourself. It affects how safe you feel in your body. A lot of us, our identity is wrapped up into our hair. That's why I don't love Barbies for my daughter. It's like the hair and everything's the same. And I'm like, oh my gosh, like where's the Barbies without hair? But it is not the end of the story. It's not the end of the story. And the more we understand the root, no pun intended with follicle, the more we can shift the outcome. So stay patient. Stay curious, and remember healing takes time and you're not alone in it. If you feel alone, find the right people to work with, find the right mentors, the right guide, the right team so that you don't feel alone. Find the community that you can surround yourself with. So thank you all so much for joining me. So grateful to have you here, and I look forward to next time. Thank you for joining me on this episode of UPLEVEL, Real Health, Real Talk. I hope today's conversation inspired you to take the next step in your health journey, one that nourishes not just your body, but your mind and spirit as well. Don't forget to subscribe so you never miss an episode. And if you found value in today's episode, please leave a review. Until next time, keep learning, keep growing, and keep thriving. And remember, true wellness is a journey, and you are on the right path.